I'm Ed Highland, and welcome to AARC's Big Ideas Theater. I'm joined now by Mary Martinasek, who is talking about some very fascinating subjects, 2 different sessions, 2 different topics, e-cigarettes, recreational marijuana, and hookahs. Welcome.
Thank you very much.
And I pause there just for a second because it's something that obviously is of great concern to respiratory therapists and professionals at AARC. And we want to talk a little bit about the research, talk a little bit about the respiratory implications of ingesting, of smoking like this, or vaping as the case may be.
So 3 different products that you mentioned. The first is electronic cigarettes or e-cigarettes. Some people call them electronic nicotine delivery systems because they don't really look like cigarettes so much anymore. And those really came into the U.S. maybe about 10 years ago with the flavored vape and have become very popular with our youth. So we're seeing an increase in prevalence. It's pretty much continued in most of the states in the U.S. The concern about that particular product is that it's really viewed as being harmful or harmless at all. And what we know from the research is actual chemicals are embedded in the liquid nicotine. So it is a liquid nicotine product. And there's chemicals, there's carcinogens, so cancer-causing agents. And so a lot of people that vape don't even realize it. They think it's merely water vapor, or they state that it's merely water vapor. So there's the concern of the chemicals that they're actually inhaling unbeknownst to them.
And you were talking in our previous conversation about the fact that people who smoke marijuana are also perhaps using some of the e-cigarettes as a device. Does it have the same potential impact when you're just putting pot in there instead of the nicotine?
So, great question. And so, as you know, since we're not legal, recreational marijuana is only legal in 7 states and D.C., we don't have the research behind that like we're getting now with electronic cigarettes. And clearly traditional cigarettes, we have a ton of research on that. So we really don't know what the implications are going to be for either the person who vapes marijuana or the secondhand vape that's produced. At this point, we really don't have that, it's such a new product, we don't have the research out there to say one way or another.
Is it the same with knowing whether or not marijuana is addictive in terms of improved delivery system, stronger pot? Does it make it?
That's a really good point. So what we know is back in the 90s when they confiscated illegal pot, they could measure the actual THC percentages in it, and it was low. It was 7% or 3 milligrams. It's just very low. And what we find now is the pot that's being grown and the hybrid versions have extremely high levels. So the THC, the hallucinogens are extremely high. So it's a different pot than way back then. So yes, they are using them in the devices, but it's a different device than what they usually use the liquid nicotine in it. So it's a separate device, but it works very similarly.
I see. Well, tell us a little bit about how these new devices, if you will, complicate the smoking cessation therapies.
So one of the reasons I got interested in doing the research that I did on marijuana is because I'm a tobacco treatment specialist and a respiratory therapist. And I would always have patients come to me and they say, well, I know cigarettes are bad for me, but what about marijuana? And as a therapist, I'm thinking, I really don't know what the literature says. So we did a comprehensive systematic review, meaning we looked at all the articles that are out there across the world on inhalational recreational marijuana. And so that I felt I could better inform the clients and the people trying to quit regular cigarettes and give them that information so that they can make an informed decision themselves whether or not they want to quit smoking marijuana.
Tough challenges and many reasons, for many reasons, including the fact that it's becoming legal now in so many states.
Right. And so I think that will help us in terms of research because there's only one university in the United States that by the federal government is allowed to do marijuana research. And so we're really bound, our hands are tied. All we have is data of people entering the hospital that have disease or have COPD or cancers, that then we can look back and assess their history and make the conclusion that there was this association between their previous behaviors and the diseases that they have now. So it'll actually open the door for more research. It's unfortunate, though, that it's becoming legal before we know the potential detrimental effects of it on the respiratory system.
So a lot of eyes on Colorado and other early beginners of this
yes.
type. Fascinating. Mary Martinasek, thank you so much for coming by and sharing your thoughts and ideas about hookahs and e-cigarettes and marijuana smoking.
Thank you for having me. Appreciate
And this is the Big Ideas Theater, sponsored by Draeger. Thanks for joining us.